As you all know, ERCP and related therapeutic procedures, if not done properly, have a formidable morbidity and mortality. And therefore, it is important that we learn this new technique in a structured way.
All gastroenterologists and GI surgeons should have basic knowledge as well as practical training about ERCP, as it is a stepping stone to a vast domain of advanced GI endoscopy. ERCP training is difficult due to limited number of cases, a steep learning curve, and unavailability of practice models. ERCP also carries a significant proportion of morbidity and mortality and complications. Hence, this course provides you the academic knowledge, practical training on virtual simulators, and a hands-on experience of performing procedures on cadaveric animal models, which mimics real patient experience.
We will be revising your biliary and pancreatic anatomy. It will be followed by videos by experts on how to go ahead with ERCPs. There are simulators on which the candidates can practice, and we have also made a live tissue pig model so that you can practice selective cannulation of the bile duct, sphincterotomy, retrieval of stones from the bile duct, and insertion of biliary stents.